much for joining us. If you're new here, my name is Molly Pelletier. I'm a registered dietitian specializing in GERD, acid reflux, LPR, and also the founder of Flora Nutrition, where we help people find relief from reflux. Today, we have a very special guest, Dr. Spencer Payne, who is an otolaryngologist, a head and neck surgeon, and the co-founder of RefluxRaft, which is an alginate company. We are going to be diving into the topic of PPIs. Are they safe for long-term use? How do they impact our body? And what are some things that you want to be aware of if you're using PPIs long-term? So this is a topic that I get asked time and time again, so I'm really excited to have a medical doctor and a specialist on the topic today to dive into your questions. And we will have time for a couple questions towards the end, so feel free to drop your questions down below. And let's see. Just going to make sure. Awesome. Here comes Spencer. Hey, Spencer, how are you?
I'm good. How are you?
Doing well, doing well. Thanks so much for joining us. I just introduced you.
Well, thank you for having me. It's a pleasure to join you in this conversation about PPIs.
Yeah, this has been really highly anticipated by my community here on YouTube, so I'm really excited to dive in. And I think a good place to start would just be kind of explaining like an overview on proton pump inhibitors and how they work in the body.
Sure. Proton pump inhibitors are one of a couple of classes of medications that are designed to reduce the production of acid in the stomach. Specifically, PPIs work by blocking a very specific enzyme in the stomach that uses energy to exchange protons or hydrogen atoms in order to create that acid. And so its effect in the body is intended to be just in the stomach, but there's a question about whether there could be other similar proton pumps somewhere else in the body that may explain some of the things we may talk about later. So they were originally designed really to address ulcers and erosive gastritis and esophagitis, but I think since 2003 they've been over the counter and have been used widely for acid reflux, heartburn, indigestion, that type of thing.
Very helpful. Thank you. So yeah, more often than not, when someone goes to the doctor for reflux, GERD, LPR, they're given a PPI for short-term use. And I was wondering if we could talk about like the difference in effects when these medications are used to short-term versus long-term.
Yeah, so specifically with like the benefit, short-term use, they're very effective in reducing acid production. The general dosing is once a day. Some people get put on twice a day dosing because the stomach acid reduction, for more or less is anywhere from 12 to 15 hours total, I think, from the larger doses for single dosing. So in the short term, they can work very well. Over time, the body does develop some level of tolerance to it because you start telling the body, hey, this we don't want this enzyme to work, and so the body says, oh, okay, well we need more acid, so it starts making more of that enzyme, and so we see that with longer term use. If we're talking about side effects, I think that's also a big difference too. And if we want to talk about short term, is kind of the accepted short term use is like 4 to 6 weeks. And then if we're talking about like long term, we're talking more maybe like 6 months or more. And I think that in between is where there's kind of some gray zone in terms of when does one thing happen versus another. But I think most of the short term complaints that people notice is temporary bloating or maybe even an increase in indigestion type symptoms, maybe some short changes in bowel habits and that type of thing, which is a big difference than say like the long term side effects that we'll dig into.
Yeah, for sure. And that's really one of the biggest concerns I hear from my clients when they've been taking a PPI for longer than a few months. They're concerned about those long-term side effects. And so what are some long-term side effects that might be associated with the prolonged use of PPIs?
Yeah, and so you just used a very interesting word, which is associated, right? And so a lot of the studies that have looked at the side effects have been association studies. And for for the viewers, there's a big difference between what's associated and what's caused by. And that's where there's a lot of kind of misunderstanding or rather incomplete data. So association just means that, like, if you look at a certain number of people with this thing, do they also have this thing going on, right? So the number of people who go to McDonald's highly overlaps with the number of people who eat hamburgers, right? But that doesn't mean that if you eat a hamburger, you have to go to McDonald's type of, I don't know why that analogy just popped into my head. Maybe it was the smash burger I had this weekend. So apologies. Not great for the reflux diet for sure. And so a lot of the studies have looked at, well, what's been associated with PPI use. And so there's been discussion about pneumonias, dementia, kidney injury. And so those are big association kind of studies where they've looked at large groups of people and they said, okay, if you are on a PPI, do you have a higher chance or a lower chance than this large group of people that we looked at who aren't on a PPI of having any one of these things? And those research studies are only as strong as the number of factors they've looked at to see if there could be some other thing, right? So you could, in essence, have done that entire study in a nursing home where everyone has some form of dementia, may have pneumonia because they lay in bed all day, and maybe because they're in their 70s or 80s have some form of kidney injury. And then you'd say, well, they're all on a PPI and they all have these things, so there's an association. And so you've got to look a lot deeper into it. Some of the meta-analyses that have looked at this, like these larger studies that then tried to pool all of that data together, has still been mixed. But there's enough question there for those types of things that you'd say, like, well, it's probably very important to think very closely about when we want to use these medications in that long term. Now, there's other side effects that, while the data is not necessarily certain, make a lot more sense from like a mechanistic approach, meaning like if we think through how do PPIs work, can that cause other issues? And at the heart of it is, if you need stomach acid to digest your food, you need stomach acid to activate enzymes to control your food. And to a certain extent, you need stomach acid to keep your small intestine safe from other bacteria. And so it does make sense, and we certainly see things like small intestinal bacterial overgrowth, where you remove the acid from the stomach and then allows the wrong bacteria to gain a stranglehold of your small intestine, and that can cause problems. You need acid in your stomach to absorb calcium and iron. And so if you don't have that acid per se for too long of a period of time, you may then see a reduction in calcium absorption, and that may be what leads to some of those associations that we see with fractures. And so I think, there's things that I would say are like higher on the list of I can explain it, versus the other things that there's just an association and we don't really know what to make of it yet.
Yeah, I think that's super important, and for a lot of people to hear, especially who, they may need to stay on a PPI. That's what's been recommended. That there's really a difference between those sensational, sort of headlines versus actually mechanistic risks that we may want to associate with your nutrition and supplement there in terms of calcium and other vitamins. So
Exactly.
yeah, really important. Speaking of headlines, I feel like every time I open my phone, I'm seeing lots of information and misconceptions about reflux. And so, what do you think some of the biggest misconceptions about reflux or PPIs are that you're seeing?
Well, I think one is, if you don't have heartburn, you don't have reflux. And
Mhm.
that's a big, I think, myth and common misunderstanding. And
Mhm.
I have a clinical practice outside of my work with RefluxRaft, and I frequently ask patients, "Hey, any heartburn, indigestion?" They're like, "No." I'm like, "Okay." And then I'm like, "Well, I still think you might have some reflux." They're like, "I don't have reflux." And
Mhm.
how do you know? Well, I don't have heartburn. And so there's that kind of mindset that I think a lot of people get fooled into. And then, a big myth with the PPIs is PPIs fix reflux, and they don't. They treat stomach acid, and that's all they do. Now, for some people, there may be large, huge amounts of acid that make the stomach tumultuous, and maybe that's partially leading to some of reflux events. But there's so much else that goes into what triggers a reflux event, or that type of thing. That assuming it's a 1-for-1 ratio is seen out there probably more than it should be, for sure.
Yeah. Yeah. I'm really glad that you brought up that point about LPR, silent reflux. And yeah, I think a lot of us, we get into this field because we personally struggled with reflux. I personally struggled with gastroesophageal reflux disease, but I see tons of clients in my practice who struggle with LPR. And I have a special place in my heart for them because it's so confusing to get that diagnosis. First of all, you never had heartburn, and now you're being told you have reflux. But then also, the PPI may not be as effective, for those with LPR. And so we might be looking into other strategies. One of those strategies I use a lot is alginates. And so I'd love to hear from you, how you use those in your practice as well.
Yeah, I think alginates have been a big boon's the wrong word, big like surge, I think, in my practice over the last decade.
Hmm.
Alginates have been around since the 1970s. And for those who don't know what an alginate is, alginates, it sounds like algae. And so technically it's from seaweed, but a form of brown kelp that's technically an algae. And so you get this alginate. And so it's this chemical that you can get from seaweed. And then when it gets into your stomach in the presence of some other ingredients, forms this gel that floats on the surface of your stomach contents and kind of acts as a barrier to prevent those reflux events. It doesn't do anything for the stomach acid, but it works much more in that mechanistic way of actually addressing the reflux. And so, I think I have a long conversation with my patients about what I think their symptoms are, like what their lifestyle looks like, what their diet looks like, and try to come up with like a very personalized but holistic approach to like how are we going to do this. And there's some people who want to have all the answers right now. If you think this is reflux, then I want to know within 6 weeks so we don't bark down this path for too long. And those might be people that they get maximal therapy, but a promise that like, hey, if you're on a PPI and it works, great. But then we're going to be talking about what we need to do down the road. And but if for a lot of people, I try to say like, let's talk about diet, let's talk about lifestyle, let's talk about these things. And alginates fit perfectly into that type of a lifestyle in terms of like managing things with minimal, if any, real risk or side effect. And so I think that's been really helpful, especially because a lot of people have heard these sensational news studies, and we can say like, all right, you know what? I'm not sure if they're true or not. Something to think about, but here's this great alternative we've got that we can use. So let's go with that.
Yeah, I think presenting clients and patients with alternative strategies is really empowering. And in addition to alginates, like the nutrition piece is essential, and just understanding like, that it doesn't have to be all or nothing with the reflux triggers. It can also be portion size, really monitoring hunger and fullness, like not letting yourself get too hungry so that you're overeating and really overfilling the stomach. That can go a long way. And then understanding, what are this variety of foods that you can enjoy and you can eat. So things like lower acid fruits like melon, papaya, cantaloupe, watermelon, lean proteins. Understanding how to implement these in your own life and your own diet can be a challenge, but it's a skill that we can learn. And so, yeah, understanding that, and then also just the way that clients are eating. One thing I see really impacting reflux is meal speed, actually, eating really, really quickly, and just overfilling the stomach too quickly can be a massive reflux trigger. So, chewing well, kind of starting that digestive process in the mouth, and slowing down meal speed has been really helpful.
Yeah, and I love that last point because I've had a lot of conversation even with my own children about like you're on your screens and you just watch them shovel the food into their mouth, and so kind of that concept of mindful eating, put the screen down, put the phone down. I mean, watch a YouTube live with Molly and Spencer while you're eating, but nothing else. Um, and but and so because and then I guess a couple of studies have truly looked at it and shown that people consume more food when they're on a screen or a device because they're not even thinking about it. You're not even enjoying the food, so what's the point really? At that point, it's just you could squirt an energy drink into your mouth and it would have the same effect. But
Exactly. When my clients ask me, like what's the biggest tip I can do? I'm traveling next week. I'm going to Italy and I really want to prevent reflux. It's actually the biggest tip I tell them is savor every single bite. Like be fully present, chew well, and really enjoy the food because you're going to be more satisfied with a smaller portion of that food if you're present there, and you'll notice that fullness cue will get to your brain in an appropriate manner. So that can be really helpful in addition to alginates and stress management and all of those things.
yeah, absolutely.
Yeah. And so what would your advice be to patients who are currently on PPIs, worried about the long-term impact on their health? What steps should they take to ensure that they're using the medications in a safe way?
Yeah, and so I think it's really important, to have a long conversation about why did they get on it in the first place. There are certain diseases where the risk of being on a PPI is probably far less than the risk of not treating that issue, right? So
Mhm.
Barrett's esophagus, where there's changes of your esophagus, and there's definitive link to that becoming cancer. Like that's not something you necessarily want to. That's not your test case for kind of de-escalate therapy per se.
Mhm.
Um, but if it's other things like quality of life type stuff, which a lot of our throat type symptoms are that kind of thing. Like, oh, I have this, I produce phlegm, or I can't, I have this problem swallowing. You're like, okay, well, let's now talk about how we can try to de-escalate that. And for a lot of people, I think it ends up being, how do you have that conversation with your healthcare provider? Because people are afraid. People are like, well, if I was supposed to come off of it, they would have told me. And so I think it's right to have that conversation and ask those questions in a way that doesn't necessarily get that provider's like the hairs on the back of their head
Yeah.
and push them into a defensive mode, because suddenly it's like, oh, you're questioning my judgment, and it's like, no, I have questions and I just want to explore what my options might be and what are the pluses and minuses of staying on this versus not staying on this, so that everybody comes to a personalized answer that works for them.
Yeah, love that. I think knowing how to have that conversation and how to advocate in a way that's like respectful and clear is super important. From my perspective as a dietitian, I think one of the most valuable things that someone with reflux can understand if they're trying to reduce symptoms on or off of PPI is just like understanding their personal triggers. And so one of the first things that I do with one-on-one clients is we start to food log. And that can be helpful, not because of maybe you've already removed all the reflux triggers from your diet, maybe you haven't, but understanding like what does your meal pattern look like? Are you going 6 or 7 hours without eating? Are you only having 5 minutes for a lunch break? Are you noticing more reflux on days you're stressed? Like understanding kind of your meal pattern is also really helpful, and kind of where the majority of your nutrition is happening in your day. Like so many people, I think our culture emphasizes having a really large dinner and eating late at night, and maybe those meals are more reflux trigger heavy as well, like a big pasta dish or a glass of wine with dinner, and really kind of rethinking like maybe you're someone that does better with more nutrition earlier in the day. So it may take some troubleshooting, but knowing that there's things to support you, whether it's alginates, nutrition, those things really can be a complementary approach to your medical treatment.
Yeah, and sleep hygiene, and when you go to bed,
Hmm.
the number of people who are having ice cream before dinner, it always
Hmm.
amazes me. And having, like which position is your head elevated? Are you on your left side? Like all of these things that we can dive into to try to help them with those things. And again, it's also, I think, helpful to give them permission, like in everything we do. If you're trying to lose weight, if you're trying to build muscle, if you're trying to quit smoking, like there has to be some level of forgiveness offered for when people like slip up, and or and it's fine. You just say like, okay, well now, like that's behind you. Let's make modifications for managing this going forward. And like, oh, it's the big family dinner and you're in Sicily. Like, okay, well, maybe not the third glass of red wine, or maybe not the I don't know,
Yeah.
carbonara, as opposed to some other, fish type meal that's lower on processed starches or whatever, so.
Yeah. Yeah, great point. Nobody's a perfect eater, and it's really about thinking, thinking more moderation versus like an all or nothing mindset usually works better for people. We did have a couple questions, and one just came in about gastritis and duodenitis. And I'm wondering how, if you have any thoughts on that, and if reflux raft is appropriate there, or
So I think, gastritis and duodenitis aren't, which, as I'm not a gastroenterologist, but that implies that there's already some damage or irritation to the stomach or small intestine lining, and so I think that requires a conversation with your healthcare provider about what the thought is on the cause behind that. Reflux raft as a mechanical blocker is really good at preventing reflux, but because it doesn't address acid levels in the stomach, it may not necessarily be of any help in somebody where high acid levels or some other
Mhm.
issues have caused that type of irritation.
Yeah, yeah. There's one question that came in from Michelle. Two questions actually that I can address. One is one. They're actually more comments, but salmon or cod twice a week. I think that's amazing. Eating those omega-3 rich foods could be really helpful for reducing inflammation, supporting overall health. So that's great. One sort of question comment was about the carnivore diet, and I hear this a lot, and it's kind of trending right now, where the diet is just eating red meat, and I think uh, dairy products as well are allowed on the diet. And for someone with reflux, gastroesophageal reflux disease, or LPR, that wouldn't be my go-to because your diet is very, very high in fat. And excess fat can be a reflux trigger. The diet really contains no fruits or vegetables, so you're not really getting that anti-inflammatory support from fruits and vegetables. And there's a pretty big risk of constipation on with that diet, which can also increase gastric pressure. So if people feel better on the carnivore diet, my question is there something else going on, like small intestinal bacterial overgrowth, where when we remove fermentation and then you're feeling much better? Like there may be something to that that we might want to dig deeper into. I'm just seeing if we had any other questions. Um, What about and do you have any thoughts on if for those who are on a PPI and their root cause is a loose lower esophageal sphincter, they've seen some sort of lower esophageal sphincter malfunction in endoscopy?
You know what? I saw this comment roll up about lemon in the reflux raft, and I missed the half of that question. I'm sorry about
Oh,
that.
that's okay. What are your thoughts on someone who has lower esophageal sphincter issues and they're on a PPI? Like, what are some other things they may need to consider, or is a PPI always indicated in this situation if there is like a lower esophageal sphincter either damage or malfunction?
Right. And so, in essence, in that situation, the PPI is treating the acid. So when the weakened sphincter is there, it's that much easier for stuff to come up out of the stomach. And so
Hmm.
that is going to trigger the pain and irritation. And so a PPI can be helpful. It's not the only thing that is needed per se, nor is it the only thing that can be used. With that type of thing, you really want to utilize strategies that support that sphincter, or at least take some of the work away from it. Right. So, weight loss is going to be important in reducing pressure on the stomach. Sleep positioning is going to be helpful for that in terms of having a ramp or keeping the head of bed elevated so that gravity is helping to keep things down, especially when you sleep, or left-sided positioning. And then other things that I think we've talked about already to, try to take some of that stress off at smaller meals, maybe more frequent meals, kind of the grazing type situation. And then things like, alginate-based products can be helpful for that because again, it's serving as a blocker to prevent
Hmm.
that. And then there's a variety of herbal remedies and supplements that have been advocated for in those types of situations where whether or not you're using some sort of a pro motility thing, like something that gets the stomach moving, whether that's bitters or certain things like that. Ginger is a pro-motility agent, was one of the reasons why we had formulated RefluxRaft with that specific ingredient. And then other supplements have been shown to help with lower esophageal tone and support. And so looking into those types of options, melatonin is helpful in that regard. Other types of vitamin combinations can be used to try to mimic that melatonin-like effect as well for those that are sensitive to it.
Yeah, awesome. I love that you mentioned the small frequent meals. 80% fullness at meals is what I try to tell my clients to strive for. Easier said than done, but such a helpful tip, especially if you have LES issues. Thanks for pointing out that question about the lemon. I just saw that roll in. And yeah, why don't we address that? Is the lemon in the lemon ginger reflux raft formulation real lemon or just flavoring?
It is real lemon, but it is like lemon flavoring derived from uh, the peel, not the actual acid or the citric acid that is what concerns most people about eating citrus fruits. And so it's totally not an issue. For those that feel like lemon is a trigger, which because maybe the taste of it induces some sort of a thing. We can't control for that per se, but it's definitely the non-acidic but all natural lemon flavoring.
Yeah. Awesome. Awesome. Thank you so much for clarifying that. I think that was great. I want to honor and respect your time, but thank you so much for coming on today. I think this was really valuable and lots of great insights and takeaways. So thank you again.
Great, thank you so much.
Yeah.
Appreciate it.
If people want to find more about you or RefluxRaft, I will link the website down below. And if they want to connect with you, what's the best way for them to learn more about you?
If they want to connect with me specifically, they can send an email to spencer@refluxraft.com. If you have specific questions about our product, you can also email us at info@refluxraft.com.
Awesome. Awesome. I'll put those down below in the description. Thank you everyone for joining. Thank you for your questions, and we'll see you at the next live.
Thank you.
Bye.